a clinic with a bright, friendly atmosphere, and patient social groups.
For folks who can't navigate appointments and just aren't going to live in that way, we offer that care here.
Nine Circles Community Health helps deliver the Manitoba HIV program.
We are, unfortunately, in the middle of a crisis.
Between 2021 and 2023, referrals to the program increased by 130%. Last year, Manitoba had 26.4 diagnoses per 100,000 people. That's over 5 times the Canadian average. Kimberly Templeton with the Manitoba HIV program says the demographics of the new diagnoses in Manitoba have changed.
This is something that's impacting folks who are heterosexual and folks who are using substances.
Houselessness, racism, structural barriers to accessing care are really what's driving these HIV rates.
That's in line with the findings of a new Manitoba study that looked at some of the barriers people living with HIV face in accessing care. They found that many people who had been diagnosed had experienced childhood or sexual trauma. They also found they'd been discriminated against due to their substance use or their diagnosis, and that discouraged them from accessing care.
Not an unexpected finding that the supporting environment that provides trauma-informed care and a holistic approach is better than one that doesn't.
Study investigator Dr. Yoav Keenan says the pandemic cut off many peer connections among people living with HIV, but the study found those connections are crucial in keeping people connected to care.
Feeling a sense of belonging and being empowered within a social structure helps with facing the barriers.
Indigenous people are also disproportionately affected by the spike in cases.
This is where we're seeing a lot of the health and social conditions that are impacting Indigenous people are here on the prairies, and we are looking at solutions that are grounded and driven by Indigenous ways of knowing and doing.
Margaret Kisakapiesis with the Indigenous HIV/AIDS nonprofit Communities Alliance and Network says more needs to be done to bring HIV care to Indigenous communities across the country.
The medications, the treatment, the prevention are there today, but yet Indigenous people aren't making it to the doors of those places.
Last year on World AIDS Day, the province announced funding for the Manitoba HIV program. And this year, the province began covering the cost of medications that can prevent the transmission of the virus. Mike Payne with Nine Circles says it is a step in the right direction, but it's just the first of many needed to turn Manitoba's upward trend downward.
When we first met HIV, it was telling us that the way that we were treating gay men and the way we were excluding gay men from our systems was making them sick. And this is no different now. And when we look at the populations who are impacted, we can see the relationship.
Iris Dick, Global News.